A video on injections. A lot of the time when you bring your snakes in or your lizards in for any type of health problems, your veterinarian will send you home with a needle as well as your medication, but not the proper way to inject them. Today we're injecting Leia. She's a red-tailed boa. She's being treated for a respiratory infection. Whenever you're injecting snakes, you always want to do it in the first third of their body, because if it's behind their kidneys, it won't actually get through their system. For general infections, you want to do an all-around injection. What we're injecting her with today is called Reptile. It's a very common antibiotic that's used in treating reptiles. It's an intramuscular injection, which means it needs to go into the muscle. The muscle that we always use on the snakes is the one right here. You want to make sure you're injecting above the lateral line and below the spinal column. This is a nice thick chunk of muscle, and it makes sure that you don't get into any sensitive organs. We flip-flop sides depending on which time period of the injection that we're doing. Today we're going to do it on the left-hand side. And go right in here. And when you do your injections, you want to make sure it's in between two scales, right into the skin. It's a little bit of a poke. Once it goes in, you want to pull back to make sure that you don't get into any major vein. If you do, then blood will appear in the syringe, and then it's a slow injection. The slower you inject, the less likely that you're going to get a bubble. That will cause it to sit there, and it won't actually get through their system fast enough. Plus, slower injections lead to less pain as well. If you've ever been injected and they just kind of jam all that fluid right in there, that's why it hurts when you do it. And then once it's done, you're just going to pull out. Try to never inject in the same spot. You shouldn't see any fluid come out of the spot as long as you injected it correctly. There might be a little bump for a day or two, but it should distribute throughout.